I remember she had just turned 16. We had her 16th surprise birthday party. And maybe a week later, she was sitting across from me at the dinner table, and I could notice a protruding lymph node in her neck. And I asked her right then, I said, "Liv, how long has that been swollen like that?" She said, "Oh, about a month," which, you know, for a teenage athlete, she was busy with her sophomore year in high school, so she didn't really pay much attention to it.
Arden had been really lethargic, and this day in particular, it was a Sunday, she was sleeping a whole lot, like very out of character for her. And we got her up from her nap and changed her diaper, and we could feel a really hard spot on her abdomen that basically grew overnight.
We had her in on Wednesday to visit the surgeon to take a look at it, and he looked at us and said, "This has got to come out quickly." And so following Friday morning, we were at Cook to have the surgery done. And as he removed it, you're still thinking the best. You're still thinking, well, she's healthy. She just played basketball, never came out of the game the other day. She's not had any of the other symptoms.
It was a Monday that we got the word from the doctor that it was malignant, and I had to go in her bedroom, my husband and I, and tell her.
We went to the emergency room, and we were living in a really small town. The doctors weren't super familiar with dealing with pediatric patients. The nurse came back in for probably a second or a third time to run blood work again. And I stopped her and I said, "This is kind of getting ridiculous. What's going on?" And it was like she couldn't talk to me. She couldn't tell me what was going on. The doctor finally came in and said, "We've run the blood work, and we think your daughter has cancer."
She was diagnosed with Hodgkin's lymphoma. So then the process started immediately. The next day we met with Dr. Albritton at Cook Children's. She gave us the lowdown and what we were to expect, and the first thing Olivia asked was, "Am I gonna lose my hair?" And yes, of course, she was. And see, here I get emotional. Sorry. Of course, that was not the thing I was concerned about.
We needed to get in the car right away and go to the nearest big city, which was about 3 hours away, right away. And she and I never went back to our house. We got in the ambulance, and my husband Teague followed us in his truck, and we drove 3 hours to the hospital, and everything happened so quickly.
It was very surreal. That whole part of my life feels like life just kind of got put on pause. It's a moment that you never prepare for. You know, it's just something that happens and you go into reactive mode.
She had a port put in, and they did a bone marrow biopsy, and then she was staged, and it was stage 4.
Just kind of life just stopped for a minute. Unbelievable short amount of time to deal with so many things.
We went through the whole regimen. She had 4 rounds of chemo. She held up like a champ. And within 2 weeks, she lost her hair. Then she had radiation treatment, proton therapy. We went down to MD Anderson, and Cook was instrumental in hooking us up that way. So we spent a month at MD Anderson in Houston, and then she was done with all of her treatment by the end of March.
It took a few days for them to give an official diagnosis because they had to run several tests, but she was diagnosed with stage 4 high-risk neuroblastoma. And we were there in Mississippi for another couple weeks, and she got her first round of chemo. And then once she was cleared from that, we brought her right to Fort Worth. So we got here probably 3 weeks after her diagnosis and had our first appointment with Dr. Granger, and it was night and day different.
Was so good about preparing you for steps along the way. It wasn't just that they threw a bunch of information at you, they sat down with you and explained things. The care was just amazing. Just the whole process, from anyone from the infusion center to her regular visits, the nurses. We couldn't have asked for a better, if we were gonna have to go through this process, than Cook Children's.
When we got to Cook Children's, it was like a weight was lifted off our shoulders. They have the equipment that you need, they have the doctors, they have the nurses, they have the technological advances that you need. But from a human standpoint, This hospital is incredible. They really try and make the kids forget what they're going through, and they really go out of their way to try and let them just be kids and have as much fun as they can. For me as a dad, being able to see a smile on my little girl's face when she's going through, the fight of her life, it really warms your heart. And I'm forever grateful for the staff here.
A friend told me this. He said, you're going to have a couple of bad days and then you'll have a good day, and you just get to a point where you try to string the good days together. And so sure enough, we started having more good days than bad, and eventually she got stronger. Once we finished chemo, her hair started growing back. We started getting back to normal things.
And now it's just been follow-ups every 3 months, and she just graduated to every 6 months. So, and she's a healthy freshman at A&M, completely cancer-free. So, that's a success story. She pulled through. And she was very brave.
It's looking good so far. I'm a freshman in college and having a good time. I have a lot of good friends. I'm at Texas A&M and working for a good degree, and I'm not quite sure where I'm going with it, but I guess I'll figure it out along the way.
She wants everything in her life to be normal, and so does everyone else. But you always have that in the back of your mind, what happens if it comes back, or what are the effects of chemotherapy? What could be in store for her in the future? So much happened in such a short period of time that, it changes your life.
It was a hard situation, it's hard for anyone. Since then, I've been happy and healthy, and I have a story now, and it feels like it gives me more of a purpose.
Oh, here she comes. Hi, Arden.
Arden did extremely well. We had multiple doctors, multiple nurses that commented on how happy she was, how well she was taking the treatments, and I thought that there was no way that she wasn't going to be fine. She had had a set of scans that were a prerequisite for her to continue with the next phase of her treatment, and we were in the hospital.
It was just another day, another part of her treatment, and they paged us, which they normally never do, after the scans, and they took us back to a room where her doctor and a nurse were. And they said that she had relapsed and that there were 2 new tumors and that it would be a matter of weeks and she'd be gone. So we were able to take her home, and about 2 weeks later she passed away.
Oh, do you love your mommy?
I want people to know my daughter, and I want people to know that her life may have been short, but it had meaning. And even though she's still not here, she's making a difference.
I think that we can learn a lot from Arden about her fighting spirit, and that's why we want to do everything we can to honor her and pay it forward, and make sure that we can do whatever we can so that another family doesn't have to go through what we went through and what our daughter went through. And the only way that we're going to fix that is through research, and research costs money. A lot of the extras that come with this hospital, things like the therapy dogs and the child life specialist, all of that stuff can have a huge impact on the overall outcome of a cancer patient's treatment. Arden knows that we're continuing her legacy and that we're doing everything we can to honor her by creating awareness for this terrible disease and advocating for places like Cook Children's and for the need for a cure.
Life now is pretty great. About 20 months after Arden passed away, Teague and I had a little boy named Camden. And, you know, it was a really hard decision for us to want to have another baby. And I want him to know everything about her and how she changed our lives and so many other people's lives. Life is good.